I get a lot of questions about the coronary artery calcium score test. It seems to be all the rage lately. You might have even seen ads online for one. I've even seen it offered up on Groupon. You might also hear it referred to as a heart scan, a calcium score test, cardiac CT scan, or a coronary calcium scan. The ads make it sound like a miraculous must-have test for detecting hidden heart disease, but is it really necessary for everyone? Even cardiologists have mixed opinions. Some doctors recommend it as a game changer for assessing heart disease risk, while others believe that it is unnecessary for most people. For some, a coronary calcium test can provide life-saving insight, revealing hidden plaque buildup in the arteries before symptoms appear. But for others, it might not be the best test, or even necessary at all. In this video, I'm going to be talking about what a coronary artery calcium score is, how the test works, who should consider getting one, and who probably doesn't need it. I will also be sharing my own experience from working in cardiac cath labs when this test was first introduced. I'll admit I did not start out with the most favorable opinion of this test, but it has come a long way since then. Hi, I'm Valerie, a wellness nurse. I believe that no matter your age or current health status, that you have the power to take charge of your well-being and live a longer, healthier life. My goal is to share with you the knowledge and tools that will empower you to make that happen. When it comes to heart disease, early detection is key. But with all the different heart tests out there, it can be confusing to know which one is right for you. The coronary artery calcium score is one of the most talked about tests for detecting coronary artery disease early, but it is not for everyone. So let's start with the basics. What exactly is a coronary artery calcium score, and what does it tell you? A coronary artery calcium score test is a non-invasive CT scan that looks for calcium deposits in the coronary arteries. These deposits, also known as calcified plaque, are a sign of atherosclerosis, which is the hardening and narrowing of arteries due to plaque buildup. The purpose of the test is simply to measure how much calcium is present and provide a numerical score that helps determine your risk of heart disease. The higher the score, the more plaque buildup in your heart arteries that you have, which means a greater risk for a future heart attack or other cardiovascular problems. The coronary artery calcium test itself is quick, painless, and completely non-invasive. There are no needles, no contrast dye, and no special preparation required. You simply lie down on a table and a CT scanner takes detailed images of your heart. A computer then analyzes those images and calculates your calcium score, a number that indicates the amount of calcified plaque in your arteries. The entire process takes about 5 minutes, and you can go back to your normal activities immediately after. Once the test is done, you will get a calcium score, which helps assess your level of heart disease risk. A score of 0 means no detectable calcium, which is a very low risk of heart disease. A score between 1 and 100 suggests mild plaque buildup and a relatively low risk. A score of 100 to 400 indicates moderate plaque, meaning that you are at higher risk and may need some intervention. A score over 400 is a strong sign of advanced coronary artery disease and requires further evaluation and management. But here is something that is important to understand. A coronary calcium score is good at measuring calcified plaque, but not so good at detecting soft plaque, which can actually be the more dangerous form of plaque. This is one of the test's biggest limitations, and we'll talk about that more later on in the video. This test is not for everyone, but it can be extremely useful in certain situations. It's often recommended for middle-aged adults with moderate risk factors who are unsure whether they need a medication, like a statin. Men between 45 and 75, and women between 55 and 75 who have risk factors like high blood pressure, high cholesterol, smoking, diabetes, or a family history of heart disease might benefit from knowing their score. The test can help clarify their risk level and help their doctor decide how to treat them. For example, if you or your doctor are unsure about whether you need to start a statin, a coronary calcium test might provide the missing piece of information to help you and your doctor decide. If you were already at very low risk, meaning that you have no major risk factors, no symptoms, and no family history of heart disease, you likely don't need a coronary calcium test. The results wouldn't change much about your recommended lifestyle, which should still focus on healthy habits, regardless of your score. Pregnant women should avoid the test due to radiation exposure. And if you've already had a heart attack or been diagnosed with coronary artery disease, a coronary calcium test isn't really necessary because it won't provide any new information to change your treatment. I remember when coronary calcium scoring was first being introduced in the early 2000s. At that time, I was working in a cardiac cath lab, and we saw several false positives from coronary calcium tests, meaning that patients came in with high calcium scores and had catheterizations only to find that their arteries weren't actually blocked at all. But the good news is that the test has improved significantly since then. Today, we have better imaging technology, standardized protocols, and a deeper understanding of how to interpret coronary calcium scores correctly. While it's not a perfect test, it's far more reliable and useful today than it was back then. One of the most important things to understand about coronary calcium scoring is what it doesn't detect. The test primarily measures calcified or hard plaque, but it likely will not show soft plaque, which can be even more dangerous because it's more likely to rupture and cause a heart attack. That's why a coronary calcium score of 0 does not mean that you are necessarily in the clear. You could still have soft plaque that the scan is not picking up. For a more detailed picture of your heart health, some doctors might recommend a coronary CT angiography or CCTA, which provides a more comprehensive look at your arteries. Be on the lookout for a future video that will discuss coronary CT angiography. No matter what your coronary calcium score is, the most important thing that you can do is to take action to improve your heart health. Heart disease isn't just about calcium buildup. It is also about inflammation, blood vessel health, and metabolic function. Eating a heart-healthy diet rich in fruits, vegetables, whole grains, and healthy fats can help keep your arteries clear. Regular exercise, stress management, and avoiding smoking all play a major role in preventing plaque buildup and reducing overall heart disease risk. If your coronary calcium score is high, lifestyle changes combined with medication, such as a statin, might be recommended to slow progression and reduce your risk of a heart attack. A coronary calcium score test can be an incredibly useful tool for some people, but it is not necessary for everyone. If you have risk factors like high blood pressure, high cholesterol, a family history of heart disease, diabetes, or a history of smoking, and you are unsure about your heart disease risk, this test might help provide a clearer picture of where you stand. It can be especially valuable if you are debating whether or not to start a statin or other preventative treatment. On the other hand, if you have no major risk factors, follow a heart-healthy lifestyle, and already prioritize your cardiovascular health, you likely don't need this test to confirm what you already are doing right. In that case, keep up the great work. Your daily habits are already helping to protect your heart, and no scan can replace the long-term benefits of a healthy lifestyle. Have you had a coronary calcium test, or are you considering one? Please let me know in the comments. And if you want to keep learning more about heart health and longevity, be sure to like this video and subscribe to my Nurse Guided Wellness channel so you don't miss future videos. Thank you so much for watching, and as always, please take good care of yourself.